Thank you, everyone. I'm joined this afternoon by Minister of Health, Adriana LaGrange, and I want to address the procurement issues at Alberta Health Services in the context of our relentless pursuit of better health care for all Albertans. I think all Albertans would agree that wait times for surgeries are too long. Hip replacements, knee replacements, and cataract surgeries are examples. And we've made progress on shortening those wait times, but they still remain too long. At its heart, that's what the questions have been raised are all about. There are people both inside and outside of government who are okay with the status quo. Some, either because of ideology or to protect their interests, accept the current results. I do not. I want to provide some more context to this. To deal with surgical backlogs, Alberta Health Services followed the strategic direction provided by previous governments, signed contracts with charter surgical facilities to help alleviate pressure on our health system and increase capacity. And because it has worked, we tried to expand these centres through new competitive bid processes. In terms of the latest RFP process for new facilities, the former CEO of Alberta Health Services made some very troubling allegations. And those allegations are serious and they are being investigated. We have asked the Auditor General to expedite his review so that we can have answers as soon as possible. I also want to make clear that AHS and AHS only was in charge of conducting procurement for these surgical facility contracts. And although they were awarded through an RFP process, those contracts have not yet been finalized, as I understand it. They will not be finalized until the organizations involved have been cleared of any wrongdoing. In terms of the review by the Auditor General, I have directed all government departments to provide the Auditor General with any information related to this matter. Our government will support the AG's office in any way it can to expedite his investigation, and I'm confident that he'll get to the bottom of the allegations. I also have our newly appointed Acting Deputy Minister of Executive Council, Chris McPherson, working to retain a credible independent third party with a strong legal background capable of investigating this matter independently of government so that we can understand exactly what occurred with regards to the procurement processes in question. Whether there was any wrongdoing or improper interference with the procurement process, and why, despite months of requests, AHS never brought any substantive evidence or documentation related to this matter to the Minister or to our government. At the same time, we must continue our work on the healthcare system refocusing. We simply will not allow Albertans to continue to wait too long for important surgeries or other procedures. Our Cabinet today has made the decision to assign Darren Headley as the Acting Deputy Minister of Health. Andre Tremblay will continue as the Interim CEO and Official Administrator of Alberta Health Services so that they can continue working with Minister Adriana LaGrange on the important work of healthcare refocusing. To that end, we will be setting up a legal conflicts wall within Alberta Health Services and Alberta Health so that Minister LaGrange, the interim AHS CEO and official administrator Andre Tremblay, and the acting Deputy Minister of Health, Darren Headley, can all continue with the critical work of transforming AHS into an effective provider of healthcare services under the oversight of the new Alberta Acute Care Agency. The legal conflicts wall will ensure the complete independence of these investigations without the involvement of the individuals named in the former CEO's statement of claim. I also want to reiterate a point I made last week. I was not involved in these procurement decisions. I had nothing to do with the process decisions or the implementation. My actions were straightforward. The government made a policy decision to expand surgical facilities to tackle the critical issues of wait times. When there were delays in implementing those policy decisions by AHS, the minister made inquiries into the reasons for those delays, just as I would expect any minister to do whenever there are delays with the implementation of any government policy or project. The minister has reported that she asked the former AHS CEO on a number of occasions for many months for information or reports on the issues that are now the subject of her statement of claim, with little or no response, and that's not good enough. The former CEO knew that procurement was about to move into the new procurement secretariat. If there was evidence of problems with AHS procurement, I'd like to know why she didn't disclose it to the minister. We will get to the bottom of what happened here, and if there's any wrongdoing, we will fix it immediately. If mistakes were made, they will be corrected. At the same time, I want to reassure Albertans of our resolve. We will not allow anyone in Alberta Health Services Management or the NDP to frustrate the progress of improving our health system. Let me be clear. From the onset of our health plan to refocus healthcare, AHS leadership has always shown us resistance, and it is clear that they would rather keep all surgeries in hospitals only operated by Alberta Health Services, which would have resulted in 62,000 fewer surgeries for Albertans last year. That means 62,000 family members, moms and dads and neighbours would not have received their hip or their knee or other surgeries that they needed. We will not be intimidated by the resistance of Alberta Health Services management and others who want to protect the status quo. This is about better outcomes for Albertans, and nothing will stop us from continuing our important work. This is why we will continue to utilize charter surgical facilities and any other service provider who will help us get the best outcomes for Albertans. And now I'd like to turn things over to Minister LaGrange.
Thank you, Premier. Last week, the former CEO of AHS filed a statement of claim. Upon review, the allegations and claims that have been made against me are false, while others will have to be investigated further as part of the Auditor General's work and the government's external third-party investigation that is being set up by Deputy Minister McPherson. We will be filing our statement of defence in the coming weeks and will be vigorously, and I mean vigorously, defending against this claim. As this case is now before the courts, I want to remain mindful of that process, but want to reiterate what my office has previously shared. Since learning of potential concerns with chartered surgical facilities procurement, I repeatedly asked AHS for documentation to substantiate the concerns that were raised. It was extremely concerning that no substantive information and documentation have been provided to government after many months of requesting it. And that is why I issued a directive in December to compel AHS to share all details related to chartered surgical facility contracts. Issuing this directive was not about shutting down the review of AHS that had started. To the contrary, it was about understanding whether there was actual evidence of problems that were raised by the former CEO of AHS, or whether AHS management was simply attempting to disrupt the growth of chartered surgical facilities in the healthcare system. It's important for you to know that since I became the minister in June of 2023, government has issued 18 directives to AHS related to health refocusing and increasing access to information. As Premier Smith has said, the use of chartered surgical facilities to address surgical volumes and help reduce wait times is a policy decision that was made by government. I firmly believe that concerns related to the procurement processes must be reviewed and investigated thoroughly to identify any potential wrongdoing or procurement process deficiencies. I am committed to ensuring our healthcare system and the procurement processes within it are beyond reproach. I look forward to continuing the critical work that Premier Smith has tasked me with and to refocus our healthcare system for the betterment of all Albertans. Thank you.
Thank you, Minister. Thank you, Premier. We'll now go into the media Q&A. We'll start off with questions here in the room before making our way online. For those with questions in the room, please make your way to the media mic. Of course, we'll be taking one question and one follow-up to get to as many questions as possible. So we'll go to our first mic.
Thanks. Alana Smith, Globe and Mail. I want to ask a bit more about the timeline. So, Minister LaGrange, you've said it was 8 months that you were asking for information. You claim that nothing was provided to you that was sufficient enough. Premier, you've also reiterated that 8 months. That's what Adriana LaGrange said. Today you're using the term months. I don't know if that still refers to 8 months. In the former AHF Chief Executive Statement of Claim, it says September 16th. Minister LaGrange, you sat down to dinner with her where she told you about the internal review into a private surgical group. In October, she says that she had a meeting with Ray Gilmore. At the time, you're a deputy minister. So I just want to be as specific as possible, and if you can provide dates, that would be great. When exactly did both of you know about what was going on, and what exactly did you do when you found out?
Well, she brought forward allegations. The former CEO brought forward allegations verbally, I would say in summer of 2024, which was roughly about 8 months ago. And I continually asked for updates as to what was going on because she was doing an internal review. And when she indicated that she wanted to go to a third-party review, that she thought perhaps there was something more, but everything was inconclusive at this point in time, I encouraged her to do so. So I knew that she was doing a third-party review, but I've constantly asked for updates. I need something substantive. My understanding is that everyone is innocent unless proven guilty. And we have also had a contract with ASG that was expiring, ASG Edmonton, that was expiring the end of October of 2024. And there was a need to, AHS actually was working on they were negotiating a new contract with them, and my understanding was that they were very close to finalizing that, but everything got paused because of the investigations, and rightly so, because we want to get down to the bottom of this. This is about making sure that we have good procurement processes within Alberta Health Services, and subsequently as we transition it to the Procurement and Optimization Secretariat.
I'm sorry, that question was for both of you.
Yeah. Sorry. I remember the minister telling me that there were some issues that she was looking at different prices for different for the same procedures at different facilities sometime in the fall, and I think that's kind of what we're looking into. Why does it cost, for instance, around $3,600 at ClearPoint versus $6,300, which is one of the ones that was just recently negotiated with Enoch, versus $8,300 at ASG? Versus 10,500, which is what the CIHI estimates for a cost of a surgery in a public hospital. We need to know that, why there are differences between that. So I think that is what the former AHS CEO was looking into. I know the minister raised it with me because we also want to understand why there are differences, and we hope that the AG is able to shed some light on that.
Sorry, just to clarify, so you're saying that the minister did raise to you the concerns and the allegations that the former CEO had put forward to her?
She raised to me that there were different prices for the same surgeries in different hospitals and different charter surgical centers, and that they were trying to understand why that was. That was sometime in the fall.
Okay, so for my second question, I just want to be clear here, and this is for Minister LaGrange. I'm just hoping you can kind of explain, so for 8 months, like you've said, and I'll quote, you said you were asking repeatedly for information from the former CEO. So you knew about this for months, 8 months is what you keep saying. So if you knew about this investigation and the allegations that were happening into procurement and into AHS and allegations of government interference into these contracts, why didn't you tell the Premier specifically about the investigation itself, the very serious allegations that were going on, and not just, as you're explaining it today, the differences in pricing?
The allegations were about contracts that AHS had themselves, first of all, RFP'd, then awarded, then negotiated, and then we're continuing to review. So these are internal AHS allegations that they were putting forward. And I would again say I am going to have much more to say in my statement of defense, which will be out in the coming weeks. But at the end of this, what I believe, and I know the Premier believes as well, we need transparency within our healthcare system. We need to know how these procurements are done and why it takes so long. From 2021 is when Enoch actually had responded, or the RFP for that Edmonton was in 2021, and Enoch was awarded it in 2022. Here we are, 2025, and that contract has not even, and it was all through AHS negotiations. It still has yet to be signed.
Mm-hmm. But to be clear, you didn't tell her exactly about the investigation that was ongoing.
I did not bring it to the Premier because it was allegations of internal AHS, and until there's proof, there was not a need. But I will have much more to say in my statement of defense.
Isn't it important to bring that up to the Premier, though, that the health system that your government is working on refocusing?
These were allegations that were unsubstantiated, that required much more investigation, is my understanding, and that is what I was told. They needed to dig further, and I said, dig further, with my blessing, dig further. Absolutely.
Even when the Auditor General indicated that he had known about it in November, you didn't think it was appropriate to tell the Premier?
I've already answered the question.
We'll go for it, Jason.
I just want to ask a clarification about this idea that Darren Headley is the acting deputy minister. I mean, does this mean that Andre Tremblay, once all this gets cleared up potentially, reverts to having these 3 jobs? And how does it work? Is it good healthcare management or administrative management to have one individual holding what's normally 2 full-time jobs and the job of a board of directors?
So Andre Tremblay is not the Deputy Minister of Health. We have Darren Headley.
Is that indefinite? Or?
That is for this period of time. He is not the Deputy Minister of Health. His sole role that he's been assigned is to be the Chief Administrator, the official administrator and the CEO of Alberta Health Services. We had heard feedback from our cabinet that they were not comfortable with the mingled role, and so we have him in that role, and then Darren Headley is the acting Deputy Minister of Health, so that we can separate those 2 roles.
My follow-up is, Premier, you've talked about your role and your lack of role in any wrongdoing. Have you had an eye constantly, or did you have an eye constantly on what your Chief of Staff, Marshall Smith, was doing vis-a-vis Alberta Health Services and Alberta Health? Were you always aware of what he was doing, who he was talking to, or was he at times freelancing?
Well, I think Marshall Smith has his own statement of defense that he's probably contemplating filing, and so
he's not a party in this lawsuit. I'm confused by that.
I would say that there's certainly some allegations that have been made against him, and I don't want to speak for him, but I would say that he had the role and function over several of my social files. And if there were any problems that needed to be troubleshooted, then he would do that. I think we have to remember that when AHS makes a decision to go out and do an RFP, awards a contract, gets involved in contract negotiations, if it's taking 4 years, it's actually quite legitimate to say, what's the delay? And that's what the minister did, and I kind of expect all of my ministers to do that.
So you're aware of everything that he was alleged, you're aware of all the calls he was alleged to have made?
I was not. I mean, he, again, as Chief of Staff, he had the role of operationally making sure that the decisions of government were executed. And government made a decision prior to me, prior to even Minister LaGrange being in this position, government made the decision to move towards charter surgical centres to reduce wait times. It was working, so they decided to issue more RFPs. AHS had the expertise to do procurement. They'd been doing it for years. And so it just stood to reason that AHS would be the one managing the process from beginning to end, all the way through to the completion and signing of the contract. And that's what I would say is what we were asking about, is where is the status of getting through to the end of this process? AHS controlled the process from the beginning to the end. They had different prices that they were negotiating with different facilities, and we need to get to the bottom of that. I'm very interested in hearing what the Auditor General has to say about it. But the role of the minister is making sure the policy that we have passed is executed. And asking questions, where are we at on that contract, is a reasonable thing to do.
Thank you, Jason. We'll go to our next at the mic.
Hey, Tim with CTV. It's not just the opposition that's calling for the health minister to step aside while an investigation can be done. We've chatted with a number of Albertans. There's even at least one person in your cabinet that's calling for that. So why do you believe Albertans should still have confidence in your health minister while all of this is looked at?
I would say it's because Minister LaGrange is the one trying to get to the bottom of the issues that were created in AHS procurement. This was when you look at some of these RFPs, all of them were issued in a period that predated this minister. The Enoch one was issued and awarded in 2021. ASG was finalized in October of 2022. The RFPs for Red Deer and Lethbridge were issued in September of 2022. And so she had nothing to do with the procurement process. This was all an internal AHS matter. And so as issues were raised by the AHS CEO, Minister LaGrange was encouraging to find out if there was any wrongdoing. She supported her. She kept asking her. I gather on an almost weekly basis when they had their weekly phone calls. Is there anything that you need to raise? Is there any issues that you have? Is there any substantive evidence that you have that there were any problems? And that's the issue, is that we never, despite even giving a directive in December to hand over any information of wrongdoing, we still did not receive anything from the former CEO. So I would say that Minister LaGrange has been doing the work that we needed her to do, which is to ensure that the policy of government to get charter surgical centres up and running and finalized was part of the approach to reducing wait times, and to hold the administration to account for foot dragging. That's what we were observing, and we were trying to understand why that was. If there is any wrongdoing, we're looking forward to the result of an internal and external review to see if we need to improve the processes. But this minister had nothing to do with any of the procurement decisions.
So you personally have no problem with the timeline here? Obviously, she was aware of some things and didn't run it up the flagpole. You personally are okay with that?
Well, look, I mean, when I look at what the objective of charter surgical centres is to be able to provide a lower cost procedure, to be able to do more surgeries in a more timely way. And when you look at the High statistics, they say that it costs $10,500 to do a surgery in a public hospital in Alberta. All of the charter surgical centre contracts have prices that are below that. And so I would say that that is in keeping with the policy objective that we have as a government. There's variation between them. We want to find out why. We want to understand why there would be variation, and we don't know the answer to that yet. Minister was asking about that. The AHS CEO was asking about that. That's part of the internal and external review. And if there's any problems with the procurement process, we need to finalize it, because we are going to do more of this. It's working. The only way in which we've been able to increase surgeries has been through charter surgical centres. A few years ago, they were doing 40,000. Now they're doing 62,000. AHS, meanwhile, they're doing pretty much the same number of surgeries that they did in 2019 prior to COVID. So it doesn't seem to matter how much additional dollars we give to AHS. They're not increasing the number of surgeries that they're doing. That is the reason why we're using charter surgical centres and why we will continue to. But we have to give the government confidence, or the public confidence, that the procurement process works. And if there's problems with the procurement process, we need to know, because many of the same people who were in AHS were the ones we were going to rely on in our new procurement secretariat. If we need to find new people to do that, we need to know now. So we're as interested as anyone in getting to the bottom of it.
Okay, so
Thanks,
again,
Tim.
you have no problem with the original complaints not being flagged to you?
We have a number of allegations made in the context of a demand letter for $1.7 million. I think we have to remember that context. And we have yet to see the minister's statement of defense that gives the other side of the story. But I would say that if we're looking into it, we have an internal review that is going on, that is being put together by Deputy Minister Chris McPherson, using an outside party so that the minister has a legal complex wall and is not involved in that. Internally, the AHS Council is going to be providing materials, so we have a legal complex wall with Andre, and we're going to also have an external party who's going to be looking at it. They have a SharePoint file that they've put together so that all of the documents that we're looking at are available to the Auditor General. We're getting the information at the same time, and we're going to get to the bottom of it.
Thanks, Tim. And we'll go to our next at the mic.
Hi, good afternoon, Premier. Jen Hodson from the Western Standard. So from what you've said today, it sounds like AHS has quite a monopoly on healthcare in Alberta. So what do you see as the best way moving forward for the province?
When we started our refocusing, one of the things we pointed out is Alberta Health Services is in a conflict of interest, being a service provider and also drafting the contracts for those who are their competitors. That was one of the things that we identified in November of 2023 that we needed to resolve. We are splitting the role of purchaser and provider. That is what we've been working forward to for the last a year, and unfortunately, we thought we had a partner working towards us and helping with that transition. And as you heard the minister say, having to give 18 directives to AHS demonstrates just how much resistance we were facing from AHS management. But good practice, ask anybody if they, as a service provider, would love to draft the contract for their competitor. It's so obvious that that should not be done, that it's astonishing that it's taken place as long as it has. So whether it's Covenant Health or whether it's the charter surgical centres, of which we have 50 that are operated by 38 different service providers, they will no longer be under the thumb of Alberta Health Services. And we made that very clear back in November of 2023, that it isn't good practice. And so that's part of the transition that we'll be making in its final stages over these next couple of months.
Okay, thank you. And would you comment on the recently released report, the COVID-19 task force?
Sure. I mean, as you know, I like to hear information from all sources, and I asked Dr. Gary Davidson to take a critical look at some of the blind spots government may have had in the last go-round so that he could give some advice about what we would do the next time we end up in a health crisis like that. So we're just reviewing the recommendations. I believe there's over 40 of them. And Minister LaGrange and I will discuss which, if any of them, we're going to implement.
Thank you.
Thanks.
And we'll take one more at the mic here before heading off to the phones. Go ahead, Adam.
Apologies, my voice is a little hoarse today. Premier, just following up one last time on this one, how can you have confidence in a minister that did not report to you serious allegations, but also the fact that there was an investigation ongoing when it comes to what appears to be quite a serious situation?
Well, let me just, I'll put the information out there so that you know what it is we're investigating. Sure. Because this is the nature of the things that we were seeing. And I'll give an example for our hip replacements. As I said, Kai says that it costs $10,500 to get a surgery done in a public hospital. The AHS original contract had a hip replacement for $8,303. Enoch has just been negotiated for $6,360. ASG had a counteroffer of $7,453. ClearPoint in Calgary, $3,622. And then ASG, Red Deer and Lethbridge, $6,950. As you can see, there's variation between them. We'd kind of like to know why. And so that was what the CEO was looking into. That was what the minister was asking questions about. This is the information that we're going to, for knees and shoulders as well as overnight stays. There's a whole chart I have here. There's some variation. And we need to know why that variation exists. Maybe some of it is completely understandable. In the case of ClearPoint, for instance, they were operating out of an existing facility that was fully built out. And so they were able to go in potentially to do a smaller amount. And also the contract price was negotiated prior to supply chain problems and the inflation crisis that we have. Others have been negotiated more recently. Some were negotiated as an interim measure to try to bridge to when the new facilities would be built. So I'm not prepared to say that just because we see variation, that is evidence of wrongdoing. If you asked us what we were able to build a school for 3 years ago versus 2 years ago versus now, it's also very different. Prices change, and we have to be able to be flexible enough to respond to that. But what we have to do is be transparent about it. If you look at the U.S. in 2021, they have a requirement that every hospital has to list their top 300 surgeries and what they charge patients when they walk in. We don't know what it costs to deliver surgeries at any individual hospital, and we've got to do that work so that then we can be assured that if we are using a charter surgical centre, we're getting the best price rather than trying to use averages. So that's what we're trying to get to the bottom of. That's the nature of the issues that the minister raised with me, and that's the nature of the issues that the Alberta Health Services CEO is looking into, and it's the nature of what the Auditor General is going to look into. And I'm very interested to hear his responses.
You mentioned seeking a third party and also that you want an expedited review from the Auditor General. What is the ideal maybe timeline when it comes to this third party looking into?
It needs to be long enough that the public has confidence that it's been thorough. And so the time frame that I've been told we should expect, if we can get an individual, we need somebody who has legal training, somebody who is going to be sufficiently independent. We've been told that's probably 4 to 6 months would be the reasonable amount of time. But look, if we find things with our own internal review that we know that we can address right away, we're going to address them right away. But the public, I would hope, would be able to get an answer within 4 to 6 months.
Thanks, Adam. We're going to head to the phones now. We have time for a couple more questions. Operator, could you put through the first caller, please?
Thank you. Your question comes from the line of Lisa Johnson from Canadian Press. Please go ahead.
Hi, thanks for taking my question. For the Premier, I'm wondering, we've heard a lot of calls recently, including from one of your cabinet ministers, that Minister LaGrange should step aside during this. I'm not sure how an ethical wall or a legal conflicts wall recuses her from this entire internal investigation, but the other calls that have been coming forward are to call a public inquiry to get to the bottom of this. Given that there are limits to the Auditor General's mandate, and given that the government is essentially investigating itself on this matter, why are you not calling a public inquiry to get to the bottom of this?
Well, again, these are AHS internal processes. AHS internal processes have been a bit of a black box to government for some time. We do block funding, And we don't see the kind of transparency that we would like to see. The fact that we're making the changes we are is so we can get transparency. And as we go through and we find anomalies, we're asking questions about it. And so it is our job to be able to hold our agencies to account, and we're going to do that. We're doing it by making sure that we have not only an internal process that is going to be overseen by an external third party so that we have the independence, but also have the Auditor General receive the information at the same time. And I don't want to prejudge the outcome. I want to identify if there's any wrongdoing. And if there is, there'll be repercussions. But we have to first understand if there's a reasonable explanation for why it is that there are different prices being charged to different facilities for the same services. We have to make sure that we understand that first.
And a follow-up, Lisa?
Yeah, thanks for that. I mean, you're also casting a lot of aspersions to be suggesting they're resistant to change, they want to keep the status quo, and that they have some sort of conflict of interest with against contracts with chartered surgical facilities. But you're not addressing the fundamental basis of these allegations, which is the allegations are of government interference into AHS processes. These allegations are not suggesting that AHS had poor procurement processes. These allegations are into government interference. So will you look into Marshall Smith's relationship with the various contractors, the other people who are named in these allegations, and their relationships with private contractors as part of this internal investigation?
Well, all of the procurement decisions were made by AHS. They were the ones who drafted the RFPs. They were the ones who went out and received the bids. They were the ones who chose the proponent. And then they were the ones who were charged with the task of negotiating the terms of the agreement. The only role that the minister or government had was saying, are you done yet? Have you got to the finish line yet? You've been working on these contracts for years. When can we expect them? And that's actually a legitimate role for government to play, is once a policy decision has been made, an RFP has been issued, a contract has been awarded, negotiations are undergoing, it's not unreasonable to ask for a time frame on that. Because you have to remember what was happening here. We have a surgical center in October that would have had to shut down and put thousands of surgeries, cancel thousands of surgeries if there hadn't been some extension to the contract as we were looking through a renegotiation of the terms. Enoch, they've been waiting since 2021. They spent their own money building a facility that is almost ready, and they're wondering, when are we going to get the contract so that we are able to finance our building? And so asking questions about where are we at in this process that you started 4 years ago is actually a pretty legitimate question. And that is something that AHS needs to answer for. So they weren't able to give us very good answers. And so now we're in a process where everything has been paused until we can make sure there's nothing wrong with the negotiations as they've been going forward and with the prices that have been negotiated. And as soon as that's cleared, we'll be able to move forward on them. But this is all internal to AHS. This is all AHS procurement.
Thank you, Lisa. And we have time for one more question. Operator, could you put through the next caller, please?
Your next question comes from the line of Emmanuel Prince from Rage Canada. Please go ahead.
Hi, my question is both for the Premier and the Minister. It's a yes or no question. Have you ever received any kickbacks from any private surgical contractors, yes or no?
No.
No. Absolutely not.
My follow-up is, what is this legal conflict wall, and why should Albertans trust that your government is going to abide by these rules this time around when the allegations are that members of your administration government did not abide by the rules or boundaries in the past?
So at AHS, Andre is the official administrator and CEO, but the person responsible for assembling documents to put into the shared file for our external investigator and for the Auditor General is going to be their acting corporate counsel. So, as you know, lawyers have professional obligations. They are overseen by the Law Society, and so that is the person who is going to be responsible for handling the AHS document management to ensure all of the documents that are needed are requested and they are shared. As I understand it, from Chris McPherson, the share file has already been established and documents have been uploaded to it, and we're just in the process. So that's one way in which Andre is going to have the legal conflicts wall lifted or put between him and the investigation. And then on the other hand, Minister LaGrange is not going to be involved in the internal review. It's going to be an external party, which we hope to be able to pin down in the next couple of days. And that person will be able to advise our government directly on what it is that they observe from AHS procurement process to see if there's anything that we need to change as we take that procurement function into Alberta Health and as we finalize some of the contracts, the future contracts for charter surgical facilities. But let's be clear, none of that is going to take place until we know that there aren't any problems with the process.
Thank you. And that's all the time we have for questions today. Thank you, everyone, for joining us.